Hello, this is Sue Pike. I am an RN working on my BSN at Aspen University. My topic is the issues involved with insurance companies and their influence on healthcare, pretty specifically related to people other than a physician or nurse with clinical expertise influencing what happens in a patient's recovery, home care, clinical care, and hospital care. My focus is on who decides what the treatment and medication courses are. In times gone past, a doctor would write out a prescription, the patient would fill it, and that would be the end of the story. Now, patients often receive prescriptions that they cannot afford. Healthcare insurance does not cover all that is prescribed. Many claims are denied. One of the things that I've had personal experience with is the option of pleurex drains, using specifically in cancer patients to drain fluid around patients' lungs, and those patients are having great difficulty, number one, affording or obtaining the bottles so that they can do this procedure at home. As a home care nurse, I'm having to obtain authorization for care on a frequent basis, and that can be time consuming, and there are roadblocks there. One of the other things I've experienced personally is that Medicare does deny coverage for intravenous therapy at home, which is one really good way to keep patients at home, decrease mortality and morbidity. As a palliative home care nurse, I have found these daily challenges in getting resources for my patient. I also have frequent interactions with physicians looking for alternative prescriptions, alternative ways to care for our patients. Social workers within our program have been very helpful to finding financial resources, but again, that's time consuming. With productivity being a part of my daily life, it takes time and energy and resources. DME companies can sometimes find free resources, but that's not always the case. Recently I had a patient who needed Lovenox because of her oncology diagnosis and her ongoing treatment, and it took multiple phone calls and work from both the clinic nurses and our home care staff. Authorization is a big hurdle in providing care. We work with many patients who receive their treatment from the VA, the Veterans Administration, and obtaining that authorization is usually not a simple task. We've had a change in process recently, and we need orders in order to start home care. So a call is put out, and it can be days before we get a call back authorizing home care. We obviously typically need urgent responses for things like preventing falls, post-op complications, and that leads to an inability to follow best practice related to insurance authorization. In regards to the relevance to BSN students, it's imperative that nursing students and new nurses understand that clinical practice is a much larger project. It's not just providing hands-on care. It's providing authorization. It's the multiple phone calls needed to help facilitate best care for our patients. We do become advocates for our patients, and we need to work with the other disciplines. It's imperative that we work with the physicians, we work with the therapist, work with our social workers, clinical staff, hospital staff, as well as whatever entity you're working with. And there is value in educating ourselves and our community as to the obstacles, and perhaps finding some way to minimize these obstacles. One of the best ways is keeping current with legislation that affects healthcare practice. So best care for patients should be influenced by nurses and doctors who are caring for those patients. I feel that health insurance companies, which employ nurses and doctors, aren't always aware of specific needs of our patients. As professional clinicians, that's one of the highest standards in our practice, is that we do facilitate appropriate and adequate care. Changing the system is going to require gathering information, interdisciplinary advocacy, and advocating for our patients and their ability to choose what is best care, and being aware of those financial issues. Thank you so much and have a great day.